Welcome to Socialpost. This is Nihal. Today we are discussing about very serious and important health topic regarding the oral cancer. Most of the people ignore small symptoms like mouth ulcers, wounds, and burnings without realizing how dangerous they become in the future. Habits like smoking, gutka, pan masala, and tobacco are increasing risk rapidly, especially among the young people as well. That is the reason today we have a special guest regarding this oral cancer, Dr. Anshul Singh. We both was discussed a lot of topics regarding the oral cancer. So please watch this video from the starting to ending and subscribe to Social Post. Hello Anshul ma'am, welcome to Social Post.
Thank you so much for having me here.
Yes, ma'am. What are the causes of oral cancer increasing these days, ma'am?
See, the main cause has always been tobacco. It
Okay.
is the main culprit for oral cancer.
Okay.
And these days, there's a lot of smoked variant and smokeless variant of tobacco.
Okay.
So, smoked is your cigars, cigarettes, pipes, snuff, beedi. And the smokeless form is the chewing type, where you have gutka, pan masala,
masala.
supari, khaini. So, all these, both the forms of tobacco are
Okay.
very harmful. There's a recent trend of hookah, vaping. All these
Yes.
are also harmful.
Hookah, we have a flavors like
Oh, yes.
yeah,
So those
orange,
flavors are really
cranberry.
addictive in nature.
Yes.
So that is a major cause of cancer too.
Okay.
Not just oral cancer, even lung cancer.
Lung cancer. Okay. Yes.
Apart from this, if a person even has alcohol, that is, so tobacco and alcohol together has a synergistic effect. Both these habits increases the cancer chances by almost 100 times more when compared to the people who do not have any of these.
Okay.
And apart from this, there are certain risk factors like exposure to sun, long exposures to sun. So that is when you can get lip cancers too.
Okay.
Then lifestyle changes, which has nutritional deficiency and stress. So these change the DNA repair mechanism in your body. It causes genetic mutations. So this can also lead to cancers.
Ma'am, what about the drugs, ma'am? So while taking through mouth, your example you're telling the smoking it in that ganja, I will say that. So what about the drugs? From that drugs also we can get the oral cancer.
See, anything that induces heat in your body, all this has many heavy metals, chemicals in it. They have carcinogens. So all this are, they impact your oral health in one form or the other, and all this can cause cancers.
Ma'am, and what are the oral cancers are common people are ignoring from the start, from the early stages? What you observe, ma'am?
The signs.
Yes.
Okay, so most common sign I think is a non-healing ulcer.
Non-healing
So
ulcer.
generally people get ulcers.
Yes.
It's a common thing.
Yes.
But then if that common ulcer which is caused because of some trauma or some infection is painful.
Yes.
And it will last for 10 days to 2 weeks.
Yes.
Now if an ulcer is painless and it doesn't heal in 2 weeks, it goes beyond it, then you absolutely have to get it checked. That can be a non-healing, firm, persistent ulcer can be one of the sign of oral cancer.
Okay.
Apart from this, patients can see some red or white patches in their mouth, in the inside of your
Yes.
cheek.
Yes.
Those are, that is also one of the signs. Then there can be some lump or thickening of the cheek tissue. All this can cause restricted mouth opening. Patients cannot really open their mouth wide enough.
Yes.
There'll be restricted tongue movement. And sometimes patients can complain of chronic sore throat, like something is stuck in the throat. That can also be a sign of oral cancer. Few patients can complain of having burning sensation when they have something really spicy.
Yes.
That is one sign of oral cancer. So these are, apart from that, sudden bleeding in the mouth. That is one of them. And if your teeth suddenly become very loose, if a patient wears a denture and it doesn't really fit well. So these are all certain signs of oral cancer, and a patient should definitely go to a dentist if they are already using these substances, tobacco, alcohol, they already have a risk factor. they should definitely go and get these checked.
Is mouth ulcers is really dangerous, ma'am, because I got a ulcer right now.
So, see, ulcers are not dangerous.
Yes.
Ulcers are commonly seen in patients because of some trauma or some infection.
Yes.
Okay, ulcers can be inside your mouth, outside your mouth. The ones which are inside your mouth is your regular aphthous ulcer.
Yes.
The ones which are outside is called your cold sore, fever blister. So these are due to some infection or some trauma or some inflammation. These are painful, they have some red edge, they are whitish or gray on inside, they sometimes have pus in it. And they heal. You can take some over the counter gel and all, and they heal in 2 weeks. But if you have an ulcer which is not healed, it has been there persistently, it recurs. Before the old one goes away, a new one comes and it recurs, it's persistent, it's non-healing, it is firm. And if you should remember a 3-week rule, if your ulcer has gone beyond 2 weeks, then you definitely have to go and get it checked. 2 to 3 weeks, it should have healed. But if it is not healing, it could be a sign of oral cancer.
Okay. So after getting the mouth ulcer, can we can drink alcohol or smoke? That's it.
When it has healed,
Okay.
see, being a dentist and we are talking about oral cancers, I'll ask you to stop these habits, But if a person really cannot stop it, please try to reduce
Okay.
the alcohol intake.
Okay.
See, according to Mouth Cancer Foundation, 90% oral cancer cases is because of tobacco.
Tobacco.
So, I, being a oral cancer specialist, I would always say to stop tobacco in all the forms. But if you are really into alcohol and all, limit alcohol intake. And once the ulcer is healed, that's up to the person. I mean,
Before
I can
healing,
just
before
say
healing the ulcer, we can intake the alcohol.
that's totally a person's call. See, ulcers are painful.
Yes, very painful.
And alcohol and all is going to irritate it further. Because how does ulcer happen? There's one breach in the mucosal lining. So anything that irritates it is going to aggravate the situation.
Yes.
Right? So I would not suggest or advise anyone to go for
Because today night I have a party. That's the reason I'm asking about the alcohol more.
And then if your ulcer has not healed for more than 2 weeks, I think I'll have to have a look at your ulcer.
2 days back I got a mouth ulcer. That's why.
So, it's all up to you. I wouldn't ask you to go for alcohol and all because it irritates the ulcer a little more.
Ma'am, can oral cancer can be cured after detecting, ma'am?
Okay, so the cure of oral
Yes.
cancer depends on 3 to 4 factors.
3 to
Depends
4.
on the stage.
Can you tell me 3 to 4 factors?
Yes, see, it depends on the stage.
Stage.
Okay, when it has been diagnosed.
Okay.
It depends on how the treatment has been planned, and it also depends on prognosis. So, if the cancer has been detected at a very early stage, say stage 1 or stage 2, that means the spread has not. It is not metastasized. It does not spread really much. We can remove it completely. We can
Okay.
plan for a surgery, do a reconstruction, remove it.
Okay.
But oral cancer is notorious because of recurrence. It is known to recur. So a prognosis is maybe 60% oral cancer cases have a survival rate of 5% of 5 years
Okay.
easily. But if it is diagnosed at an early stage and the treatment goes well, then 80 to 90% survival rates are there.
Okay.
So, in other words, any cancer for that matter, if diagnosed at an early stage, can be cured. But you need to have regular follow-ups with your surgeon.
Surgeon.
Yes.
Without any follow-ups, we can't do it.
No, it is notorious for recurrence. So, follow-ups is absolutely mandatory.
Ma'am, and what is biopsy, ma'am?
Okay, so how do we confirm if it is oral cancer?
Yes.
So, when we first see clinically, we just check all your oral tissues. But if we feel there's something suspicious, we ask the patient to go for a biopsy. So, biopsy term sounds very scary. It's actually not. It's
Okay.
simply taking a tissue sample from your mouth and checking it under microscope. So
Okay.
that we can come to a proper diagnosis and it helps us plan the treatment. Without the biopsy, we cannot come to a diagnosis. It
Okay.
is absolutely essential to come to a proper diagnosis.
Ma'am, is biopsy is painful, ma'am?
Not really.
Okay.
Biopsies are conducted under local anesthesia. So we first numb that particular tissue or that area of the mouth where we want to conduct the biopsy. And then within 15-20 minutes, we finish the biopsy process. We just remove a small tissue sample, and we even give painkiller medication to the patients. So there's not pain as such, there's mild discomfort.
Okay.
Mild discomfort. And that lasts for hardly 2 to 3 days. So biopsy sounds scary, but it is not. It is not something patients should be so scared of. In fact, I think the waiting period from the test to the result, that is more scary. The procedure itself is not scary.
Okay. Ma'am, how important is, radiology in diagnosis, ma'am?
Okay, so biopsy is something which we can see from the surface.
Yes.
Okay, if the cancer is there, it will not be just at the surface. It spreads. What is cancer? Cancer is a growth in the tissue, right? Any abnormal tissue or any abnormal cells which keep growing is cancer.
Yes.
So we can see, once we can see visually, then if we see something suspicious, we'll go for a biopsy. But how will we know how far it has spread? That is where radiology helps. So
Okay.
radiology is something which we can see under the surface of the tissue. So we have many, radiology imaging techniques. We have CT scan, we have MRI, we have PET scan, we have normal X-rays, OPGs, CBCT. So these help us to know how much the cancer has spread. If it has spread only to the heart tissues, if it has spread to the bone or the muscle or the lymph node, how much it has metastasized. That is important, and that can be done only with radiology.
Okay.
And if you do not go for radiology, we cannot really, we cannot know what is the stage of the cancer. We cannot know how much it has spread, and we cannot plan efficiently. If we want to increase the survival rates of the patient, we want the proper treatment planning. That can be done with radiology. So both biopsy and radiology are essential to come to a proper diagnosis and plan for the treatment.
Okay.
Yes.
Ma'am, can oral cancer can be detected during routine dental checkup? Can we detect there, ma'am?
Absolutely.
Okay.
So
How?
a dentist is actually trained to
Okay.
look for something which a normal person cannot. When a patient comes to us for a routine dental checkup, we can check all the the entire oral cavity, the tissues inside. We check for the red or white patches, and we check if there's any non-healing ulcer. We check for lumps, check for thickening, some fibrous bands. So that is, it's like 70 to 80% cases can get diagnosed if a person comes for a routine dental checkup, and we already did it. In my career, I've diagnosed patients with pre-cancerous conditions,
Okay.
and we could actually save their lives before it went to a cancer. So a dental screening is mandatory to every person, irrespective of tobacco or alcohol use or risk factors, at least twice a year. But if a person is already with the habit, they have this habit of tobacco and alcohol and all, then they should go for at least once in 3 months dental checkup.
Okay.
So in the causes, one of the essential, very newer causes, even HPV infections. So those HPV infections, they don't even give you any symptoms
Okay.
of oral cancer. That is the reason why you need it.
Ma'am, does oral cancer is occurring in young people, ma'am?
Yes.
Yes.
Oral cancer these days, unfortunately, we can even see in patients as young as 20 to 30 years of age.
20 to 30 years. The reason, ma'am,
The
why that
reason
is?
is, there's this smoking is very common in young patients these days, along with alcohol. And there's even HPV infections which are getting very common, especially HPV 16 strain causes oral cancer. Then there is genetic predisposition.
Okay.
The inherited genetic mutations. That is also one of the cause for oral cancer in young patients. So sadly, yes, HPV, this oral cancers is common in young patients.
Yes. So what are the precautions these young people should take, ma'am, before getting the oral cancer?
Absolutely abstain from tobacco and alcohol.
Yes.
Okay. And I feel the younger generation has a really strong willpower. And there's so much of social media influence and all that.
Yes.
They keep spreading this awareness of how dangerous these habits are. They can actually help themselves to protect themselves from this oral cancer. Prevention is better than cure.
Yes.
So don't go for something which has this capability of causing cancer. So apart from smoking or any type of tobacco, alcohol. They need to even ensure that they maintain good oral hygiene. So if you maintain a proper oral hygiene, you will not have these non-healing ulcers and all, because non-healing ulcers can even happen because of a broken tooth.
Yes.
And nutritional deficiency causes cancers. So ensure you have proper diet,
Yes.
proper hydration, and if you have you're prone for longer sun exposure, go for an SPF lip balm. Protect yourself with an SPF lip balm, and do a routine self-examination. Very important. Just take out some time to examine your oral tissues, and that should be enough.
Okay. Ma'am, and what are the daily habits should we follow before preventing the oral cancer?
So the daily habits start with brushing twice a day.
Okay.
Okay? Clean your tongue. Floss in between your teeth. You go out, use an SPF lip balm. Have lots of water, because that ensures your oral microbiome is really good. Then self-examination. Take out 1 minute a day, in a month at least, to examine your oral tissues, your cheek, your tongue, your gums. Check for everything. See if you can see any red or white patches. See if you can see any ulcer.